thank you guys so much for joining us today. We're going to have a very exciting topic today, and I know we had meant to come on a little bit earlier, but we had some computer issues, and so we want to thank you guys so much for tuning in, and we've got a very exciting topic for you guys. So please feel free to put your comments in, and we'll definitely go ahead and go from there and take it from there. So today we have a very exciting topic. We're going to talk about, does your weight affect your health? This is what we're going to talk about here today. So thank you guys so much for tuning in. We have Dr. Ferrara here. Dr. Ferrara, you want to say hi?
How you doing? Hello, everyone.
Say hi to everybody. So yes, we have Dr. Ferrara here, and he's going to help answer that question, because a lot of people have questions specifically about like weight and things like that, and they want to know, does weight affect your health? Dr. Ferrara, what would you say?
I think the answer is pretty obvious. I would say the answer would be yes. And when you mean by weight, I bet you everybody out there is automatically thinking about being overweight, but
right.
Also one has to look at the opposite end of the spectrum, which is underweight.
Okay.
So both, the answer is, and I think it's pretty obvious, yes. Weight does affect health, whether you're overweight or underweight.
Mm-hmm.
And we'd love to hear feedback from out there on what they think, say being overweight or underweight, how to affect your health. What are some things that you think it will affect? And the answer is probably going to be right.
Absolutely. And so we want to hear from you guys. We want to hear a little bit from you guys and let us know exactly what you guys are thinking about today's topic, because, like I said, a lot of people, like you mentioned, when they think about weight, they typically thinking about being overweight. But again, like you said, underweight is also an issue.
Underweight is just as important.
Exactly. So we want to hear from you guys. Let us know what you guys think about today's topic, and we'll definitely go ahead and go from there. I know we have a lot of people who are viewing, and we had people who actually chimed in and made comments.
Or were interested in the event.
Absolutely. Very interested in the event. So this is why we're here, to help educate you guys and to give you some information about what we're going to be discussing overall today. So let us know. What do you guys think? Does weight affect your overall health? So let us know.
I think, I start with overweight. I think being overweight, first thing is, no matter what disease you have, if you do develop a disease, it's going to complicate things worse.
Mm-hmm.
So first thing that your increased risk of being overweight is diabetes, adult
Okay.
onset. Usually most people who become diabetic, the way they call it adult onset diabetes, or just take a pill, not insulin, is secondary to being overweight. And by overweight, we're not talking about 10, 15 pounds. We're talking about actually we're going to the extremes, close to obesity or being obese.
Okay.
And if you remember, we talked about in past shows that sometimes by just losing weight and exercise, you can decrease that diabetes, get rid of it. I've seen people do that. But then the other thing that I've noticed was that even hypertension, so increase your hypertension,
Okay.
increased risk of complications. The main thing is complications from surgery,
Mm-hmm.
or you develop a disease. So somebody would say having a heart attack when they're obese versus non-obese, you have dramatic increase in complications such as death, but just being overweight, because all of a sudden you got a weaker heart, having to fight against a greater body weight, but also surgery. Imagine trying to have surgery, appendicitis or emergency trauma, just makes things so much more, just more complications.
Mm-hmm.
Also, if you had cancer, the chances of recurrence, such as breast cancer, is more likely when you are overweight.
Wow. So
Yes.
say that again. I mean, we need to hear that. That
I
was
think
really good.
even with cancer, somebody who's, let's say, big cancer, like breast cancer, the chances of recurrence is higher with increased weight.
Okay.
Because I think cancer feeds on sugar.
Wow.
Yeah. So I think that is, so almost any disease you can think about just makes it more dramatic.
So it was something.
But also, I was talking about also with guys, it decreases libido, because a lot of that estrogen, the fat, it takes basically converted to more estrogen, less testosterone. And in women, similar effect, where it causes decrease in libido.
Wow.
When you be overweight, and also with increased risk of erectile dysfunction. So there's a lot of when you're overweight.
Something you just said that just got my sugar and cancer. That was really interesting that you just mentioned that. I'd love for you to kind of just talk a little bit about that.
is a doctor actually in Florida who has decreased the rate of recurrence of a lot of his cancers, but mainly watching the sugar. All processed sugars increase risk of recurrence. He just found that the more obese you are, but I think it's secondary to the sugar you feed it.
Okay.
You have increased recurrence and growth. Patients who, after having cancers, who watch their weight, watch their sugar intake, somehow they have a better response to therapy and also have a less risk of recurrence.
So if you're skinny and you like to eat a lot of sweets, is that an issue as far as cancer is concerned as well?
Yes.
Wow.
Yes.
Wow.
I think diet in preventing recurrence and controlling of it, it's not a big part, but it's a small part that in the big picture does have an effect.
Wow, that's amazing. So if you guys are just now tuning in and watching us, we're talking about, does weight affect your health? And this is what we're talking about. Again, and Dr. Ferrara mentioned that a lot of times people think about weight as far as heaviness, but we're not necessarily even talking about that today. We're talking about, being skinny, and there's issues with that as well.
Yeah, for decreased weight, basically, the first thing is obviously if you have decreased weight, you end up increased issue of malnutrition. And malnutrition obviously decreased energy, decreased just mostly chronic fatigue that brings on the malnutrition. Also, you have to talk about vitamin deficiencies.
Mm-hmm.
If you're underweight, you're going to have some vitamin deficiencies, so issues with your hair and your vision and other things, and skin. Also, anemia, increased chances of anemia, low blood, which gives you hypotension, the opposite of high blood pressure, a lot of times, and just feeling weak all the time. Also, don't forget, you're not getting enough vitamin D intake or calcium, so you have increased risk of osteoporosis. It means bones, increased chance of bones just being frail. Also, decreased immune function. Many studies have shown the more malnourished you are, the increased chances of infection, so you decreased immune system. That's what we talk about, why diet is important to improve the immune system. We talked about before. And same as obesity, increased risk of complications from surgery. And also, obviously, for females, fertility issues. From the female point of view, when you have decreased fat in your body, decreased chances of having menses. So if you look at female marathon runners, athletes are very thin, or people are malnutritious, they lose their menses per month. So decreased chance of fertility, and same thing for guys on the other end, erectile dysfunction. So decreased fertility issues. Plus you have, the depression and sin.
Absolutely.
So you have risks on both ends.
Wow.
From not eating right or eating too much.
Okay. That's amazing. If you guys are just now tuning in, please put your questions up there. If you have any questions for Dr. Ferrara today, we're talking about does your weight affect your health? And this is what we're discussing here today. So please feel free to put your questions up there if you have any questions. This is the time to ask him right now while he's right here, and you can get information. We're here to get free information from doctors,
yes.
but
those are things that actually affects, I think, men. We always have to question men versus women. I think it affects men versus women equally as far as being overweight or underweight. I think that is an equal issue.
So would you say men tend to be overweight, or it doesn't matter, they're both kind of equal?
I think they're equal.
Okay.
It all goes down to, I think from the beginning, the best prevention, the best way to fix obesity is to prevent it before it happens.
Mm-hmm.
You just watch what you eat. And usually it starts at the young age, and eating the right things.
And it was something you said the one time that, I always have to kind of remember and mention. You mentioned before that, if you walk just like 30 minutes a day, every single day, and you don't have to be consistent as far as you can walk maybe 10 minutes here, 10 minutes there. You said it increases your chances of living by, was that 10 years?
10 years.
By 10 years, just by walking 30 minutes a day. So, I think that's pretty amazing to even hear something like that.
But I think exercise, just, pushing maybe a brisk walk, get your heart rate going. You feel much better from an energy point of view. All of you out there who exercise on a regular basis, when you stop exercising for those 2 weeks, 3 weeks because of an injury or for some other reason, how do you feel? You realize the energy level goes down.
Absolutely.
Yeah.
Absolutely. So this is what we're discussing here today. So if you guys have any questions, feel free to put your questions up there, and we'll definitely go ahead and answer any questions that you guys might have about today's topic, because, again, we're here to give you guys information about some of these things that Dr. Ferrara knows about, and he'd love to answer any questions that you guys may have when it pertains to today's topic. Again, we're talking about, does weight affect your health? And, again, I think this is some very good information. And also, too, you mentioned about vitamins. Can you talk a little bit about that as far as health is concerned as well?
Well,
in
Mostly
weight
you
rather?
get, I think you get vitamins normally for eating the healthy foods, eating the right vegetables, eating the right foods, drinking the right foods. You get vitamin C from orange juice, for example, vitamin E from carrots, or beta carotene you get it from carrots. Just eating the right vegetables. I know a lot of people are into vitamin supplements. I think it's good. However, you can achieve the same effect eating the right food.
I see.
The vitamins you need, to manage the hair, so you have nice hair that stays in.
So I can grow my hair. I can grow
your
hair.
vision.
My hair will grow if I eat the right.
Yes, it might.
Guys, this is what we're discussing here today. So if you guys are just now tuning in and watching, we're talking about does weight affect your health? And so you had mentioned vitamins. And when you say like the right foods, I mean, we hear that a lot, but we don't know what the right foods are. Can you tell us what some of the right foods are?
The right foods is usually not anything processed, such as buying candy and popcorn and pepperoni. How about just it's okay to eat vegetables?
Okay.
And it don't matter how you cook them, even raw. It's okay to eat things that have protein in them, such as chicken or fish or meat, eating fruit, some grains. Those are all okay, better than just eating junk food.
I see. So if
or fast food.
If you guys are watching right now, and so would you say it's better to cook at home than to go?
Depends what restaurant you go to, really.
Okay.
Yeah, I mean, if you go to McDonald's, I would say eat at home. But there's some good restaurants that actually cook very healthy. You just have to look for them. I think it's always best to cook at home when you can regulate how much you eat in the amounts. Plus, I think if you're a good cook, you always eat better at home anyway.
Absolutely. I like home cooked meals better. Yeah. I mean, but, a lot of times people are busy and they don't get a chance to, cook at home. They just literally are on the run.
Some places are pretty healthy. I just found one down the street where we live. I don't know if we'd like to mention places that I thought was very healthy and very tasty. It's a place called Gusto.
I've been there. That's one of my favorite places. Yes, I love Gusto's.
And it's healthy, right?
Yeah, it's very healthy. I mean, you go there and they give you like your chips and your little, and the chips are like.
I haven't tried the chips.
The chips are pretty cool too. So you can get a bowl. It's really good.
I usually get the bowl.
Okay.
Then the other place is, I want to say Zen something. It's Peachtree Battle.
Okay, I'm not familiar with
There's
that.
Like well, there isn't. It begins with a Z. I know it begins with a Z.
I think I know what you're talking about. It's in that plaza over there.
Yeah, across from the Starbucks.
Right. Absolutely, I know what you're talking about.
You can eat healthy there.
Right.
And also, right next door to where Urgent Care Peachtree is, there is the Sunflower Cafe.
Yeah, I've been there before.
A vegetarian restaurant.
Yes, I've been there before.
It's excellent.
Even though I'm not a vegetarian, the food was really good.
No, it was very good.
So if you guys are just now tuning in and watching us, we're talking about, basically, does weight affect your health? And a lot of people have questions about this topic here, and I'd love to get your questions answered today with Dr. Ferrara. He's right here to answer any questions when it comes to your health.
Yeah, the weight is, besides most people want to lose weight, especially or want to gain weight to look better, which is noble, which is great. However, I would say think about the health reasons of it. You want to lose weight because less chance of diabetes, less chance of hypertension, less chance of complications from surgery. Also, you live a little longer. Less, also on your joints. Think about when you're overweight. A lot of people have knee and joint issues.
So is that one of the big reasons why a lot of people have those knee and joint issues because of weight? Okay.
But a lot of orthopedics and a lot of people say, "Oh no, it's if you just lose weight, your knees might feel less strain." And they're right. The orthopedics doctors are right. If you do lose some weight, that is less pounds, 40, 50, 60, 70 pounds that your body has to carry. That's less strain on your knees and your joints.
I see. Wow. So thank you, guys. We have Leslie just said, how about this? Can health affect your weight? For example, a friend couldn't lose weight to control his diabetes. Then he found out that high blood pressure made it hard to lose weight.
Yes, obviously health can do that, but even things like, Leslie, things like such as hypothyroidism. Yes, you have to control the hypothyroidism first before you can lose that weight. You have to control, I guess, the diabetes first before you can lose that weight. You're right, because you have to eat a certain diet in order to, if you're a diabetic. However, usually the diabetic that you do lose weight, you control the calories, that you can control weight.
Now, Mo had a question, too. Mo asked, should you be a vegan?
If you prefer to be that, it really doesn't matter because as far as health issues, does vegan make you have a less chance of a cancer? The answer is no.
Wow, say that again.
Yeah, does vegan give you less chance of cancer? Not necessarily, no.
Okay.
I mean, all you do is look at Linda McCartney, Paul McCartney's wife. She was a big advocate of being a vegetarian, but the rate does not increase whether you're vegan, whether you eat meat or not. I think though the one thing I have noticed that people who are vegetarian, when they age, they do look much younger.
Okay.
That's one thing I noticed, and they live and tend to live a little bit longer, statistically, just a slightly longer, about a few years longer, by being vegetarian.
Okay. All right, mostly you can still eat the cow.
But being a vegetarian is not bad as long as you get your protein like through legumes, things like beans, and etc.
Absolutely. So if you guys are just now tuning in, we're talking about does weight affect your health? And this is what we're talking about here today because, like I said, we're not just talking about being overweight. We're talking about also being underweight because there's issues with being underweight as well, like you mentioned. Can you mention any other issues about this concern that you know of as far as being underweight?
Well, the underweight, eventually, if you go very much underweight, then eventually you're going to get to the point where malnutrition. But those are extreme cases.
Mm-hmm.
And that's just because the heart just wears away. Your muscles, your body starts feeling, first it takes away from your fat as far as to survive, and then starts going away at the muscles to survive,
mm-hmm.
To get its proteins for its enzymes and glucose, etc. Eventually you'll go away, your heart, and you die. Those are extreme cases.
Now, I think a question that that I have is how do you know if you're overweight or underweight? I mean, how do you judge?
I think, the standards are made arbitrarily. Where what's a normal height? What is a normal weight? When they do the standards, I think they just take thousands of people and say, okay, this is the normal way you should be. I mean, I think, if you looked reasonable, not overweight, obese, I think the extremes are being obese or being very too thin. I mean, if you can see your bones, you're too thin. If you're very thin, and you can see literally your bones, and you're too thin. But if all of a sudden, I think if you have a lot of fat folds, etc., then you're, overweight. I think ideally you need to have a little bit percentage body fat, at least 15-20%. But the standards are all based on, and I think more individual, what is right and what is wrong. But overall, I mean, it's pretty obvious. You know who's overweight.
Mm-hmm.
If you're let's say 5'4", and you're weighing 200, 250 pounds, you're definitely a 5'9" male, and you're weighing 250 to 300, 350 pounds.
Wow.
But even if you're like 6'4", 6'5", and you're 300, 400 pounds,
you're overweight.
You're overweight.
Wow.
I mean, usually go look at the fat fold. Not everybody's perfect. Nobody's going to have a perfect body.
Mm-hmm. Discussing here today. If you guys have questions today when it comes to weight and health, this is the time to ask right now. Dr. Ferrara, right now we had some questions already that came in, and we'd love to hear your questions. What questions do you have when it comes to weight and health? Because this is a very important topic. Most has a bit of sound issues from the friction restart. Yeah, we know it's some issues, and it's probably the water behind us.
Yep, here in Tampa. But no, so apparently we cannot hear anymore. Okay. Hold on a second. We're going to fix the sound.
Okay, it looks like we are back on, so we can hear the sound here now a little bit better there. So we have. So Moses, do you see what the health movie? I don't know what that meant, Mo. Could you say that again, Mo? I think Moses.
Don't understand what you mean by the health movie.
Mo, let us know exactly what you mean there, Mo, and we'll definitely answer that question that you might have there, Mo. If you could just ask that question again, Mo.
In some cultures, being thin is considered great, and other cultures, being obese is considered great.
Absolutely.
Look at also in some sports like sumo wrestling.
Okay, Mo said Netflix movie called What the Health. He said, have you seen that movie? It's called What the Health.
Mo, I have not seen that, but now that you mention it, I'll probably look at it. I do have Netflix, and I like that name, What the Health. A documentary, What the Hell, that sounds interesting. I will look at it.
Absolutely. So if you guys have questions about health and weight, I'd love to get your opinion about this, and Dr. Ferrara's here too, that you guys may have about today's topic, because it is a real topic. It is something that people, my brother Tim said it's called What the Health. Yeah, we've got it, Tim. Thanks for that comment there. So we want to know.
But next week I'll give you a commentary on it.
Oh yeah, next week we'll give you a commentary. You heard him, so he'll let you know what he thought about that movie. So, but we want to know from you guys. Let us know, what are your thoughts when it comes to health and weight, and what do you? Let us know. Just feel free, and we'll definitely go ahead and take it from there. So just put your comments up there and let us know what are you guys thinking about health and weight, because this is a serious topic here. Like we mentioned earlier, you don't have to necessarily be overweight. We're talking about it's also people who are underweight where there's issues. So again, we're talking about a lot of issues in general when it comes to individuals when it comes to their weight. Please let us know.
If you would I try fruit and vegetables only diet as a cleanse? It depends. I mean, there's a lot of mixed reviews. Does fruit and vegetables work as a cleanse? I mean, there's a lot of people who give you different theories, but nobody's actually, I can tell you, no proven scientific study that fruit or vegetables is a cleanse. Or I have another one that believe it or not, coffee enemas, where they cleanse your bowels using coffee. They say it cleanses also your liver, but again, no study's ever been done on that. Or one I saw the other day talked about fasting for 3 days. It cleanses your gut. It all depends. What do you mean by cleanse? Do you need it? Nobody's actually defined what they mean by cleanse. When I hear all these doctors who are promoting it, or gurus or sellers, and they can really define it for me. I'm trying to listen. Okay, how does this work? What is the physiology behind it? How does anatomically does this work? Nobody's been able to explain it. No good studies have said this is better than another. What do you mean by cleanse? And does it help, let's say, decrease your cancer rate, or make you have better bowel movements, or improve your health? Nobody's ever really proven that, no, but it's a great question.
And my brother Tim says, great topic. So thanks a lot for that comment, Tim.
Thank you, Tim. But so, Mo, it just nobody really knows. What I do is, it's nice to say, remember the guy with the coffee enema? Looking this up, they actually.
Wait a minute, say it again.
Coffee enemas, but they literally. I don't think might work, might not. I can't knock it, but some doctors convincing people to go home and put enemas of coffee, about a couple of liters of coffee up their rectum to cleanse. I'm not sure if it works. The way it was explained, it does from point A, point B, and somehow your liver gets cleaned and your bowels get cleaned, and does all this to your body, and this, and I can connect the dots. I mean, the doctor, the way he was talking, he was connecting dots beautifully. In my mind, I was like, not that he's crazy. I said, I don't see the physiology behind it. And I'm sure I'm going to get some emails on this, and
right,
some nasty comments for having said that, but I'm just speaking my mind.
And also says, no processed food or meat or fish, just fruit and vegetables.
No, it cannot hurt, because that's being a vegetarian. As long as you get your protein and nutrition, you cannot just eat bananas every day or just broccoli. The one thing you do need for protein synthesis and your enzymes is protein. And I'm not talking about it has to be a lot of protein. How much is your body of protein in a day? And I remember one time in medical school, how much do you need per day of protein? And let's talk chicken. Literally a piece of chicken, just this small, very, very small, is enough for your 24-hour supply of protein. So we're not talking about a whole steak, a whole piece of chicken. And you can get the same protein. If you're a vegetarian, there's books on that. They can give you more detail. Is eating things like legumes, beans. Essentially, if you had that, it would give you some protein.
Wow, great questions. Troy, thank you so much for joining us. And so, Ann, thank you so much for joining us. So we are here with Dr. Ferrara, and he has, if you guys have any questions about today's topic, and that he love to cover some of those questions that you guys may have out there, because I know a lot of you have already asked some great questions out there so far. So please feel free to put your comments up there, and this is why we're here. This is a great topic, and we love talking about these things, and Dr. Ferrara loves to help educate people about these particular topics as well. That's why he's here every week to discuss these things. So please.
And we discussed before, for those of you looking to lose weight, it doesn't matter really what diet you use. It's consistency and following it through. It doesn't one and you stick to it and you follow it, the calories. I think still the best one, because you can see what is happening, is what I call calorie counting, especially today's cell phones. There are places where you just count your food, how much you eat, you set in there, how much weight you want to lose, what your weight is, tells you how fast you want to lose it, and there you go. And you just have a limited amount of calories per day. You can eat what you want to, and if you add exercise, you lose more. So basically, you use up more calories than what you take in, and that's how you lose weight. That's there's no simple formula. It's just a matter of giving into the dessert, giving into that extra hamburger, etc. It's that simple. But it's hard. I understand it's hard.
Right.
But you just got to prove it. And the second comment is, if you do it slow over time, it's not going to happen over a week. It's going to happen over months. Okay, sometimes to a year. And
Mo also asks, are protein shakes healthy?
Yeah, some people, that's how they get to protein. I know most, they say, if you're going to get protein shakes, you have to have at least 30 grams of protein. Yeah, they are healthy. There's nothing wrong with that. It's the only time I've seen protein shakes become bad when they add the extra stuff to make you more manly or more this or more that, because usually means they have some kind of steroids in there, and they're not necessarily good for your body. But if you're just plain protein, like through whey, that's fine. There's nothing wrong with that.
Great questions, guys out there. So please, if you have any questions, feel free to put them up there, because we're not going to be here long. Just wanted to come on today and give you some information on this particular topic today. And we had a lot of great questions out there today as well. So please, feel free to put your questions up there, and we'll definitely go ahead and go from there. Do you have anything else to say about this topic? The weight and health?
No, I think we covered it all. Topic, because I think we're going to have less health issues by just controlling the weight, especially, let's say, obesity. You just cut down a lot of the diabetic population in this country, the hypertensive population, and in the country also complications from surgery and other illnesses, which means you cut back the health care cost. Also, the joints. Joint surgeries, but just losing weight. So many people have joint problems because of the weight. Mm-hmm. Actually, the more people lost weight, our country would be healthier.
And it's funny because before, but I think it's kind of good to bring up. I had just wanted to know, like, sometimes a lot of people, when it comes to eating, you may eat later. Is eating later for you as well, or does it matter that you can eat later in the day, like maybe around 8 or 9 or 10 o'clock at night? For weight's sake, we're talking about weight here.
From a weight point of view, more likely to eat earlier, because then you're going to use up size or move around more if you eat earlier. When you just eat late and go to sleep, then your body is obviously using up. You're still going to digest the food, but those calories are not going anywhere. They're staying with you.
Because I remember I read something long ago where a lady had just, I think she stopped eating after 4 o'clock, and her weight just dropped off with no new exercise. Just stopped eating after 4 o'clock, and her weight just dropped off. So,
but also when you're after 4 o'clock, when you're home, you tend to eat more. Grab the snack here,
right.
Grab the fruit there, grab the piece of cake over here, and
right.
grab this over there, this over there. That's the main reason.
Right. That's true.
That's the reason that you after 4 o'clock, if you don't eat, you'd be amazed how much extra stuff you don't eat.
Wow. That's amazing. So, guys, thank you so much for watching. This is exciting today, so I hope you guys had fun watching this topic today. And so feel free to put your comments up there, because, Dr. Ferrara always gets back with people as we go throughout the day. So, if you have any other questions or anything else you want to bring up, please feel free to bring those questions up. And he's, like I said, here to answer those questions that you guys might have about today's topic, and we'll definitely go ahead and go. Thank you guys so much for watching.
Thank you for watching.
And it was fun with you guys today. Thanks a lot. Appreciate it. We'll be back on next week, right?
Yes.
Absolutely.
Of course.
Thanks a lot, guys.